To PKRC, and I've also instructed the states for home quarantine for those who are at home quarantine for us to provide pulse oximeters to people who are home quarantine if they are also categorized as at-risk patients. Untuk brought-in death, saya ingin memaklumkan bahawa sehingga bulan Ogos, ini tak termasuk data daripada bulan September, sehingga bulan Ogos, saya tolak data September ya, 2,417 brought in death. Tapi apa yang saya nak maklumkan kepada media adalah daripada 2,417 brought in death sehingga bulan Ogos, 217 ataupun 14% sahaja berada di bawah jagaan KKM ataupun pengamal perubatan swasta. 14% only were under the care of the Ministry of Health, Jabatan Pejabat Kesihatan Daerah, CAC ataupun klinik swasta. 86% tidak mempunyai mereka yang mana they were not under any medical observation. Sebab itu kita akan usahakan supaya antara strategi untuk mengurangkan brought-in death ini adalah untuk memastikan bahawa jumlah yang tidak berada di bawah medical observation ataupun pemantauan Kementerian Kesihatan Malaysia, CAC, Pejabat Kesihatan Daerah ataupun local GPs dapat ditingkatkan. So we are studying, we are deep diving, we instructed bahagian BPKK, bahagian Pembangunan Kesihatan Keluarga to deep dive this morning on the cases where they were not under any supervision, medical supervision or observation, to find out why that was the case, so that we can better advise the public to ensure that you get tested, or once you have onset of symptoms, serious symptoms, you are referred or you're sent to CAC or to your local GP. Saya juga ingin memaklumkan sebab perkara ini akan keluar dalam GitHub nanti. Kita juga telah terima banyak tanyaan berkenaan dengan breakthrough death, ya, yang dah lengkap vaksinasi tetapi meninggal dunia, ya. Saya nak nyatakan dan kita semua dah melihat kepada data secara terperinci bahawa vaccines work, vaccines save lives, dan vaksinasi tak kiralah jenis apa vaksin pun, ia akan memberi perlindungan kepada kita. Tetapi masih berlaku sedikit breakthrough deaths, ya, dan kita telah dapati bahawa untuk fully vaccinated, ya, daripada populasi negara yang fully vaccinated, yang telah menerima 2 dos lengkap vaksinasi, yang meninggal adalah 0.009%. The breakthrough rate of deaths for those who are vaccinated is 90% per 1 million population. Jadi message dia adalah, of course there will be breakthrough deaths, dan ini berlaku di seluruh dunia. But you are better off with the vaccine than without the vaccine. Yeah. So the breakthrough amongst those who are fully vaccinated was the breakthrough mortality was 0.009%. So get vaccinated, or don't doubt that the vaccination can help you. Dan daripada mereka yang meninggal ini, yang lengkap vaksinasi, 81% had comorbidities, 81% had comorbidities, and 80% were over the age of 60. Yeah, so that also contributed to the outcome of mortality in those cases. Saya akan berhenti di situ. Saya akan buka kepada soalan.
berkaitan lagi kepada sistem kesihatan.
Apa stres? Stres. Dalam perkara ini, kita sedang memastikan bahawa kita dapat memberi kaunseling kepada barisan petugas hadapan kita, dan kita telah menggerakkan unit psikologi kita untuk melaksanakan kaunseling kepada mereka yang rasa tertekan. Kita juga sedang melihat apa lagi yang kita dapat melaksanakan untuk kita cuba meringankan beban mereka. Tapi saya melihat contohnya kejayaan kita di Lembah Kelang, ya. Kejayaan kita di Lembah Kelang apabila vaksinasi sudah pun berjaya, kita sudah mula melihat kapasiti yang kritikal di hospital agak menurun, dan ini telah mengembalikan satu sense of relief di kalangan petugas-petugas barisan hadapan. Jadi soal untuk kita teruskan usaha untuk memastikan PIK berjaya, langkah-langkah intervensi kesihatan awam berjaya, ini juga akan menyumbang kepada stres pasukan petugas barisan hadapan itu dapat kita kurangkan. But we are also extending our psychology services to our frontliners to ensure that they can be they are given counselling so that they can manage their stress. But I think the key message daripada KP dan saya adalah we are seeing light at the end of the tunnel, dan kita harap bahawa mereka akan bertahan untuk beberapa minggu lagi, insyaAllah. Okay. I've lost the mic. Hold on. Yeah, the mic's not working. Semua tengah ni, tengah down. Okey. Boleh. Mic is still not on. Kita telah mengadakan mesyuarat penyelarasan tengah hari tadi, Kementerian Kesihatan Malaysia dan Kementerian Pendidikan Malaysia. Dan kita telah bincangkan dan bentangkan kepada Kementerian Pendidikan Malaysia perancangan vaksinasi untuk golongan remaja, ya. Perancangan vaksinasi untuk golongan remaja. Saya akan serah kepada Menteri Pendidikan untuk membuat pengumuman berkenaan dengan tarikh pembukaan sekolah. Tetapi apa yang kita telah setuju adalah serentak dengan proses pembukaan sekolah itu, kita akan terus mempergiatkan pemberian vaksinasi kepada golongan remaja. So it will happen in parallel, ya. Sama ada kita dapat selesaikan semua sebelum perancangan pembukaan yang akan diumumkan oleh Menteri Pendidikan. Saya rasa mungkin tidak sempat semuanya, but we will continue to vaccinate, yeah, while the Ministry of Education announces the timetable for school reopening. But the meeting this afternoon dengan Kementerian Pendidikan Malaysia, we would like to thank the Education Ministry because they invited us. We were allowed to give our views based on science as far as what a safe reopening of schools would look like. So we're quite happy with what was tabled by the Ministry of Education, dan saya telah maklumkan bahawa proses vaksinasi akan berjalan serentak dengan gradual opening of schools, dengan pembukaan sekolah-sekolah secara berperingkat. Saya telah memberi tugasan kepada Yang Berhormat Datuk Dr. Nur Azmi, Timbalan Menteri Kesihatan, yang akan menjadi penyelaras kepada program vaksinasi untuk golongan remaja. He will be in charge of the adolescent vaccination, ya. Jadi saya yakin bahawa we will work together with Kementerian Pendidikan Malaysia. Ada beberapa kaedah model pelaksanaan vaksinasi, but the easiest one will be, of course, when we go to the schools to give the vaccine. Most of the students will be vaccinated at their schools.
There has been an increased calls by the public to allow single individuals to also be allowed to travel interstate to meet their parents, especially after a recent case we saw a depressed individual who accidentally killed himself when he was at a mosque. I think it was in Terengganu, the case. Can we expect an announcement on the decision soon, or is it already in the pipeline?
I would say that it's in the pipeline. Kementerian Kesihatan Malaysia is sentiasa melihat kepada data dan risiko, penilaian risiko. I've discussed this matter regularly with KP, and when we feel the time is right, then kita akan membuat sure kepada MKN. For now, saya harap kita sabar sikit lagi untuk kita melihat indikator yang penting yang saya bentangkan tadi itu menurun bila kita melihat bahawa soal capacity healthcare kita agak baik, kita akan membuat sure kepada MKN untuk benarkan untuk rentas negeri. Yeah, it's in the pipeline, not yet, almost there. Be patient. Allowance, cuti tambahan. Yeah, we can consider.
Selamat petang lagi, Tan Sri. Ada dua soalan ya. Berbagai aduan dan malas daripada penduduk bahawa mereka tidak memiliki sijil digital walaupun lengkap menerima vaksin. Dan satu lagi, ada yang telah menerima dos pertama tetapi tidak ada update untuk dos kedua. So boleh minta komen? Thank you.
Ya, semua masalah yang berkaitan dengan MySejahtera ini saya telah mengarahkan pasukan MySejahtera untuk selesaikannya dengan segera, ya. Termasuk masalah tidak ada sijil digital ini yang menjadi kebimbangan ramai yang dah lengkap tetapi masih lagi belum dapat sijil digital mereka dalam MySejahtera. Saya telah memberi mereka tempoh masa seminggu untuk selesaikan ini semua, ya, supaya dapat diberikan sijil digital. Buat waktu sementara saya benarkan supaya kad physical vaksin dapat digunakan, the physical vaccination card, dan bagi mereka yang ada di Selangor dan telah menerima vaksinasi melalui program Selvax, ya, dia ada sijil mereka dalam selangkah, they can use that for now, yeah, until they get their MySejahtera digital certificate. So we will continue with the present reporting for another week or so, and then after that it will transition to the midnight update. No, the regular DG update will continue for a few more days until we figure out how to transition. Yeah.
So okay, not sure yet.
About a week. Ya, Sinovac telah menghantar permohonan kepada NPRA tempoh hari, tapi data dia tak lengkap. Sebab itu ditolak, tapi saya telah minta pihak Pharmaniaga, iaitu Product Registration Holder untuk Sinovac, untuk buat permohonan baru. Sebab sudah ada terbitan dalam Lancet berkenaan dengan clinical trial untuk golongan remaja bagi Sinovac, ya. Dan mungkin ini kita juga perlukan disebabkan kalau sekiranya remaja itu ada alahan anafilaksis yang mungkin dikaitkan dengan vaksin mRNA Pfizer, dia ada pilihan untuk vaksin yang lain. Okay? Virtual punya soalan? Oh. Apa ni? Yeah. Who's first in the Ram Anand, Straits Times. Singapore.
Hi, can you hear me?
Yes, I can hear you.
Okay, just two questions. First, I think last week, earlier this week, you mentioned about the goes above 100% in some areas because of the census not being updated yet. And you also mentioned second problem being undocumented migrants might also be contributing to the number. So do you have greater clarity as to the extent of undocumented migrant problem that we have in Malaysia because of the vaccination process? Like what is the proportion of them that is contributing to this, above 100% statistic compared to the lack of updated census? That's one. Second question is, recently Dr. Adam announced that people who are coming in through ECA from Singapore or any foreign travelers who are vaccinated overseas, they need to get their vaccines verified, the certificate verified at the district health office here. So we're getting a lot of questions from travelers about how are we supposed to go about the whole process, how long it takes, and all of that. So if you have any further details, that would be awesome.
On the first question, it's a very dynamic denominator, and we can't really estimate how many foreigners or undocumented foreigners there still are outstanding from receiving the vaccines. And I'll tell you why the denominator is dynamic. For instance, in Klang Valley, the denominator or the vaccination percentage is more than 100%. Yeah? That means that the actual denominator is bigger than the official denominator. But we were told by the Pahang State Health Director that in Bentong, the district of Bentong, the vaccination rate is something slightly above 80%, but she can't find anyone anymore to vaccinate. That means that we suspect, and the hypothesis is that some people from Bentong cross the state line to get vaccinated in KL. So until and unless we finish most of the vaccination, as in open up PPVs for walk-in and let people come in for a certain number of days, we are developing a protocol for declaring a particular area as almost fully vaccinated. So once we've exhausted those who have been registered, we open up for walk-in for a certain number of days. We reach out to Jabatan Kebajikan to see who may be at home, pesakit terlantar dan sebagainya, vaccinate them. And after a while, if people are not making appointments, people are not showing up for walk-ins, we assume that that area has been fully vaccinated. Of course, there will still be people who will come forward to want the vaccines. Perhaps this is a small number of people who are anti-vax. Later they find out that they cannot do things because they've refused the vaccines. They can be vaccinated at the Klinik Kesihatan after that. Yeah. On those who are travelling back, yes, at the moment, the process of getting your MySejahtera digital certification is a bit cumbersome. You have to physically go to the Pejabat Kesihatan Daerah. I have instructed the MySejahtera team to come up with a virtual way of doing this. So they don't have to come, go to the Pejabat Kesihatan Daerah, show their vaccination card from the UK or from Singapore, from wherever, and then only after that the process flow starts for them to get the digital certificate MySejahtera. This is too cumbersome. It's too much. I've asked the MySejahtera team to simplify this so that it can be all done virtually online for you to get your MySejahtera certificate. Of course, we want to assure that quality control is there, that no bogus certificates are being considered for the MySejahtera digital certificate, but I think we can simplify the process. That's in the works right now. Firdaus?
Wabi nak tanya sikit pasal hari ini dalam sidang Johor, Menteri Besar mengatakan bahawa akan terima 100,000 Pfizer daripada Singapura. Sesudah daripada itu, Kementerian Singapura kata masih ada perbincangan. Wabi ada komen sikit.
Yeah, the discussion is between Singapore and Pfizer. We are ready to accept. Tetapi sekarang ini adalah some details that have to be discussed between the Singapore government and Pfizer. But we hope that soon they can send the vaccines to Johor. That was the contribution that was promised from the Singaporean government. Online, BFM.
Hi YB, this is Tanya from BFM News. I will be asking 2 questions. Can you hear me, YB?
Yes, I can.
Perfect. First, recently we've seen allegations of unvaccinated individuals paying private clinics for the COVID vaccine certificate. What efforts are being taken to detect and prevent this? My second question is, the Human Resource Minister says you can use the Occupational Safety and Health Act against workers who refuse to get the vaccine. What are your thoughts on applying the law on anti-vaxxers?
Okay, as far as the private clinics who are accused of giving out fake vaccine certificates, of course, if there's a report, then we can get the police to act on it. But I will also ask CCAPs to monitor and to do regular audits of private clinics to ensure that this is not happening. Ya, ini adalah cawangan yang mengendalikan ataupun regulates the private healthcare providers. On the second question, which was, what was it again?
My second question is, the Human
Okay,
Resource
yeah, thank you.
Minister-
Occupational Safety
Yeah.
and Health, yeah, Act. So again, as I said in my press conference last week, we are not calling yet for federal mandate on compulsory vaccination. But if there are sectoral mandates that people want to implement that doesn't go against the law, then by all means do so. We encourage that, yeah, because kita dah kata dah, if you cannot receive the vaccine on medical grounds, we will give you an exemption. KKM will give you an exemption. But we encourage people to get vaccinated. So we encourage people also to have sectoral mandates to mandate that they are fully vaccinated. Contoh, Sabah government has mandated that all the Sabah government servants are vaccinated. This is good. So it's done on a sectoral basis. Okay? Any questions? Yeah.
Good evening, YB.
Hold on. I've got one here.
Rakyat sudah dimaklumkan negara akan masuk ke era pandemik pada Oktober. Apa persediaan kerajaan untuk educate kefahaman rakyat mengenai sekarang itu dan bila nak buat? Lagi dengan pengumuman endemik ni, adakah maknanya negara dah mengaku kalah dalam berlawan pandemik COVID ni? Dan satu lagi, adakah kerajaan fikir pengumuman endemik ni terlalu awal atau ia selaras dengan plan herd immunity?
Pertamanya, kita dengan adanya varian Delta ini, saintis seluruh dunia sudah mengatakan bahawa untuk mencapai herd immunity agak susah, ya, disebabkan varian-varian baru. Sebab itulah kita terima hakikat bahawa mungkin endpointnya adalah peringkat endemik. Dan ini bukan hanya Malaysia saja yang kata. Singapura pun dah menyatakan bahawa COVID-19 is endemic. Saya rasa tidak ada negara yang akan mengatakan bahawa penerimaan SARS-CoV-2 ini sebagai virus yang endemik adalah mengaku kalah terhadap pandemik ini. This is just the way that the virus has evolved, and this is just the way that the virus has behaved with the new variants. So ia bukan mengaku kalah, but it's to adapt to the reality on the ground. Negara seperti Singapura pun yang pada asalnya melaksanakan containment supaya kes dia sifar, telah menerima hakikat bahawa they probably cannot get 0 cases anymore. They announced yesterday that they're stopping announcing the linked and unlinked cases, so that they don't chase every single case. Australia, at one point containment 0. Now they are learning to accept to live with the virus. Sama juga dengan New Zealand, ya. Sebab walaupun kita asalnya melaksanakan lockdown dan containment, the way that the virus has evolved dengan varian Delta terutamanya, dan mungkin varian-varian baru yang mungkin baru saja dapat kita detect, kita kena terima hakikat bahawa we have to live with it. Saya sebutkan tadi akhir bulan Oktober, tetapi ini banyak bergantung kepada varian. Banyak bergantung kepada what takes place in the next 2 months, ya. apa yang akan berlaku dalam 2 bulan akan datang. Andaian saya adalah dengan adanya vaksinasi yang tinggi, kadar vaksinasi yang tinggi, pada akhir bulan Oktober kita boleh mula peralihan kepada endemic stage. Not on the 31st of August suddenly completely endemic, of course not. We start the transition to an endemic stage, ya. That will take some time. Tetapi ia banyak bergantung kepada tingkah laku kita dalam 2 bulan ini. Kita jangan ingat bahawa dengan ada vaksinasi semua SOP tak perlu kita patuhi lagi. Ini perkara yang DG sendiri tekankan setiap hari. Just because we have a high vaccination rate, it doesn't mean we abandon all public health measures. Wearing your mask, observing physical distancing, avoiding crowded areas where possible, ensuring good ventilation. Ini satu perkara yang saya tekankan ni, good ventilation. Sebab itu bila gymnasium dan fitness center nak buka, saya minta hold dulu. Sebab kita nak bagi garis panduan yang jelas berkenaan dengan pengudaraan. Termasuklah tadi dengan Kementerian Pendidikan Malaysia. Insisted on good ventilation. Jadi semua ini memerlukan masa sedikit untuk kita educate, untuk kita memberi penerangan kepada publik bahawa vaccination alone tidak akan melindungi kita daripada virus SARS-CoV-2 ini. Dan langkah-langkah kesihatan awam yang lain perlu terus dikekalkan melalui SOP yang lebih mudah difahami dan tidak terlalu complicated selepas ini. Okay, one last question on the online.
Good evening, YB. I'm Kanmini from Kodu. I have 2 questions for you. Dr. Sinhui states that more than half of 27 deaths reported September 5 to 6 in Sarawak were fully vaccinated. Most of the victims were aged above 60. Does this indicate waning immunity since the first batch of elderly in Sarawak got their second jab 4 months ago? Will you roll out booster jabs for elderly in Sarawak like what Israel is doing? And my second question is, Sarawak's COVID hospitalization and ICU capacity has already exceeded your 50% and 70% targets. So it will continue rising along with their surge in cases. What public health intervention measures are you strengthening before the whole country enters the endemic phase next month?
Yeah, thank you. We had a long discussion this morning about Sarawak. I'll be heading over to Sarawak maybe next week to discuss with the state government on what additional measures we can take to try to reduce the transmission. I've also asked the technical working group that advises on vaccine selection to quickly provide JKJAV with recommendations on booster shots because we are not sure what is driving the transmission in Sarawak. One possibility is the waning effectiveness of the vaccines over time, which we have seen in other countries. Other countries have started administering booster shots, especially to the elderly, the immunocompromised, healthcare workers. So we are certainly not ruling that out. I've asked for the report or the recommendation to be made as soon as the next JKJAV meeting, which is next week. And then I'll sit down with the Sarawak state government to discuss what the strategies are going forward. But I'd also like to add that Sarawak has taken the proactive step by starting yesterday of vaccinating the adolescent population, and they'll do so very quickly to ensure that the vaccination coverage of the total population increases. But of course, in terms of testing, tracing and isolation will be very important in Sarawak right now. Because what happens or what is happening in Sarawak could possibly happen in other states in a few months' time, when if it is because of the waning effect of the vaccine. So we have to see what are the immediate measures that we can do to stop the increased rate of transmission in Sarawak, and use that as a playbook for other states which may encounter the similar situation. So other countries, you know, the best vaccination country at one time was Israel, and they started seeing cases rise after 8 months or so. So that tended to suggest, 1, the Delta variant, 2, the effect of opening up the economy, and 3, the waning effect of the vaccines. So we are starting perhaps to see that in Sarawak, But again, I've asked for a greater, more granular analysis on this, and we'll be able to announce something when I head over to Sarawak nanti. Okay? All right, thank you everyone. Terima kasih. Abela, one more. Okay.
Yeah. The second question is more on the public health intervention measures before we enter the endemic phase, because we cannot consider vaccination as the only indicator, as according to experts' views.
Yeah, so I think as far as public health measure is concerned, we have to educate people to take responsibility of their own status. Yeah. So I think when we get towards mitigation stage, now late containment towards mitigation, you have to look after your own status. Symptomatic cases, especially when you develop symptoms, test quickly, isolate yourself. And then we will also introduce a new contact tracing technology at the end of this month that will assist us in tracing close contacts. Yeah? The other thing is, of course, I announced that we will be announcing also the national testing strategy going forward in the mitigation phase, and also for certain different sectors. For instance, just now in our discussion with Kementerian Pendidikan Malaysia, part of the new public health measures for certain schools will be testing. We will be testing, not just vaccinating, but also testing. So all these things will be announced from time to time as we transition towards endemicity. Thank you very much.